I'm Marshall Seidling, president of Lancaster City Alliance. This is the first time we've had a merchant meeting actually on its actual day and time in a while. So everyone, everyone welcome. A few ground rules. I want to remind everyone that we are recording this. So make sure you consider that as you make your comments or any gestures. Just kidding. But we are recording this for future generations. Please remember to mute yourselves. There will be, feel free to put questions in the chat area as we go through the agenda, and there will be time for Q&A at the end of our esteemed panel's presentation, which I'm looking very forward to. Before we get to the panel, there are a few things that I wanted to cover. One, I did want to introduce Ed Harris. Ed is the very new president and CEO of Discover Lancaster. And as you know, Discover Lancaster has been a partner with Lancaster City Alliance and the DID for quite some time. So I wanted to give Ed the opportunity to introduce himself. And then we'll offer to Ed that we invite him back to do a presentation for the entire merchant committee. Maybe we can even dedicate an entire meeting to you. But Ed, welcome, and tell us a little bit about yourself.
Great. Nice to meet you, everybody. Thank you for having me, Marshall. Very excited to be here at Discover Lancaster. I'm into my 8th week, actually, here on the job. The team has been outstanding with my transition here. I spent the last 6 years as the Chief Marketing Officer at the Valley Forge Tourism and Convention Board, representing Montgomery County, Pennsylvania. So to be here at Discover Lancaster, which was a rival of ours in the tourism space for a while, is going to be really fun to be here because I love Lancaster. It's got so many great assets from a tourism standpoint to talk about. And then from a lodging standpoint, we've got such a great variety, as everyone knows, of hotels, bed and breakfasts, motels, etc., where we're tasked to help fill up those rooms and really promote all the great things to experience here. So right now, our team is focused on activating a CARES Act grant that we received from the county commissioners a few weeks back, where we're promoting the area as a safe and open place to visit within a 75-mile radius of here. So we're basically making people aware right now that we've got lots of things to do that are open, but most importantly, those places that have been opened in a very safe manner. So encouraging people to wear masks, encouraging social distancing, all the things that the CDC is requiring, you'll see woven into our marketing messaging that's going to be rolled out now and through the month of September. So it's an exciting time to join Discover Lancaster and have the support of all 3 county commissioners by awarding this grant. And again, I'm really lucky because there's some really great talent already here in place at Discover Lancaster. So I'm looking forward to working with you and just getting to meet you hopefully in person in the future and learn more about how Discover Lancaster can, bolster Lancaster City and just the awareness of things to do in Lancaster City and beyond. So, like you said, Marshall, I'd be happy to come back in a future meeting and give a presentation on not only the marketing and some of the messages we'll be putting out there, but also the performance and the metrics and how our campaigns are connecting with our target audience.
Great, Ed. Thank you so much. And if you don't mind me saying, Ed's already come in as a partner. Like Discover Lancaster has just stepped up as a sponsor for Restaurant Week. So thank you for that as well.
Absolutely. I'm excited to try all these new restaurants, Marshall.
Right?
For me, they're all new. So I gotta make sure I invest in a treadmill, I think, too, at the same time. But
yeah, that may be a good idea. Great. All right. So again, Ed, thank you very much. While we're talking about programs, I did want to do a plug for our annual Velocity Even with this pandemic, we are going to have Velocity this year. We've had a team that's been working on this for months. I'm very excited, and I want to thank the team led by Susan, who is here, and Kathleen for all the hard work leading up to this event. This year is going to be a bit different, but the theme remains the same. We're still celebrating a city moving forward together, but this will be a virtual Velocity this year. The evening will be emceed this year by our own Amber Strazo and Izzy Smith-Waddell. So we're looking forward to that. It's just going to be a fantastic time. It's going to feature, as always, local restaurants, musicians, bartenders, and boutiques. There'll be a cocktail and food demonstrations, live music, and the ever popular fashion show. Can we go to the next slide, Jeremy? And new this year, we actually have some swag. So support Lancaster City Alliance and the DID when you purchase these one-of-a-kind Velocity pillows and tote bags, celebrating our city. You'll see, as you can see in the logo, that they celebrate our beloved landmarks, and it helps support our business community, especially during this time of uncertainty. So just as a reminder, the money that's raised by Velocity goes towards marketing initiatives and community development initiatives directed towards the merchant community. So it helps the DID and Lancaster City Alliance do what we do for the merchants. So please support this in any way you can. Next slide. New this year as well, there will be a digital Velocity lookbook that will be sent out to all attendees to enjoy. It'll have local features from participants from that evening. The VIP lookbook will feature exclusive food and cocktail recipes, and this is free advertising for merchants that want to be part of this. There's a link, and there'll be links of all the opportunities to either register, participate in the lookbook, in the chat room, and we'll make sure that we send them all out in the minutes. But for those merchants out there, this is a perfect opportunity to do some free advertising to all of the folks that are to all the folks that will be enjoying this one-of-a-kind event. I think we have the next slide. Yeah, this is just sort of a sample of what the lookbook will look like. These aren't downtown merchants. Again, this is just an example of the quality that we'll be pleased to share with the participants and those watching Velocity this year. Next slide. And next slide. And next slide. So it's September 24th. Remember, it's going virtual. The tickets are on sale now. So if you haven't gotten your tickets, please do so at velocitylancaster.com. Also, please help us to promote this event. There are general admission is free this year, but the VIP tickets with the special lookbook are available for $50. So this is the one fundraiser that Lancaster City Alliance and the DID do. And again, just to reiterate, it does go to support the work that we do for the merchant community. So please help us spread the word. You can also text LCA to 243-725 to give at any time. We'll be saying that a lot through the year, not only for Velocity, but a lot. So please, again, help us spread the word. And if you have any questions, feel free to ask us. But please look for the links that are in the chat room, and we will send out those links as well as part of the minutes. Yes, I believe we will have posters. Correct, Kathleen? You're on mute. You're on mute, Kathleen.
That's rare. We will not have posters this year, Marshall, because of it being a virtual event. But there will be lots and lots of, including this morning's post at 7 a.m., a posts online that you can share, comment, like, and that would be greatly appreciated. Also, emails that will be sent out. We'll be doing email blasts about Velocity.
Great, thanks, Kathleen. Susan, anything you'd like to add?
Nope, I think you covered it well, Marshall. I just want to make sure that all merchants know, and I hope they do in the minutes. I see we don't have a whole lot on the meeting today, that this is free advertising opportunity. How many times do you have that to promote your business and to showcase it in a way that you show photos, your address? It links directly to either your e-commerce site or your website or wherever you want it to go. But the deadline is this Friday, the 21st, for people to get into the lookbook. So.
Great, thank you, Susan. Okay, so now it is my esteemed pleasure to introduce our panel, our expert panel. Again, as you all know, that SCORE has been a great partner to Lancaster City Alliance, forever. They put together a fantastic panel on sustaining safe business operations. This is about OSHA regulations, air quality, cleaning and disinfection, employee health and wellness concepts to promote a safe work environment and exceptional customer experiences, especially during COVID-19. I will introduce our great panel and then turn it over to you all. And just remember, if you have questions, please use chat, and there will be time at the end for a Q&A. Our expert panelists include our friend, Robert Teak Drummond. He's Executive Director of Corporate Partnerships for Penn Medicine, Lancaster General Health, and Penn Medicine HealthWorks. And he is also the board chair for Lancaster City Alliance. So Teak, welcome. We also have Lori Holmes, Health and Wellness Specialist for Americhem International. Lori, welcome. Monica Riccozzi, our specialist from Enter Training Solutions LLC. And we have Carl Schack, HVAC specialist from Berkshire Mechanical. So welcome everyone, and SCORE, I will turn it over to you.
Thank you very much. We're very happy to be here today to talk to you about sustaining small business operations. If you could show the next slide. These are the folks that were just introduced. Next slide. So why safety considerations today, and why are we speaking about those? Really, it's very critical right now to operate safely. We know that our businesses depend on it. We've learned a lot over the last 6 months. We also know that there's lots of competing priorities and rapidly changing conditions, and really it's difficult sometimes to even sustain a focus that is necessary for safety. So today what we wanted to do is focus on some basics and also some key measures that we've learned along the way to maintain that safe business operation. And we believe we got you covered today. Next slide. Our agenda will be, we'll go over some tips. We'll have each of our expert panelists present. Teak will actually have some time after his slides to answer questions directly, because we wanted to give him some additional time to do that. And then at the end of our presentation, we'll have an opportunity for questions, but feel free to ask questions through the chat box during the presentation. Next slide. This training presentation is meant for instructive purposes only, and it does not constitute legal advice. We do not provide assurances of compliance with many facets of applicable law. Next slide. So tips on maintaining operations, you could open the first. I think here is it's very important to continue to follow federal, state, and local guidelines closely. We know that over the last 6 months, we've seen things change very rapidly. And as business owners, it's really critical for us to get those updates in a timely manner. Our advice is really to make sure that you tap into each of these areas, and they usually have Facebook or some sort of a social media account that you can actually get updates at a timely level and very up-to-date time frames so that you can make sure that you keep in touch with those. Next slide. Oh, sorry, not next slide, next point. The safety plan is really critical. I've been doing a lot of these presentations. Teak, I'm sure you'll say this. It's not if, it's when you'll be facing a COVID situation. And when you do, it's critical. It's like you're scrambling for information at that time. Having a plan in place that actually states what your policies and procedures should be, how you're following them, but also what to do in the event that you have an incident where somebody may be exposed or somebody actually has COVID, either an employee or a client, is really critical. And having that plan in place is just it makes sure that things go seamlessly and smoothly for you. The CDC and OSHA have a real nice step-by-step process for how to put that plan together. Next point. You want to continue to update your employees and customers regarding your processes. I can't emphasize this enough. There's definitely some fatigue around safety protocols. I don't know if you've experienced this as owners yourselves, where employees might believe, oh, why are we doing this? This is extra work. We haven't had anything happen, not to their knowledge, what have you. And it's very critical to reinforce your processes, make sure that people understand what you're doing and being consistent with that piece. It's just human nature that if time goes on, people may necessarily get a little bit lax. So make sure that you're using some sort of check process where the people might have to check off and also spot check how things are going. The next piece. This is the reason why you want to really make sure that you're reinforcing that culture of caring, that you really do care about your employees' health, you care about your customers' health, that's why we're doing this. We care about each other. And you'll hear more in this presentation, particularly from Teak as he's going through the numbers. But Lancaster County still is at a moderate level of infection. In fact, that means that we still have a fairly significant community spread. And you need to treat everybody like as if they're infected in order to prevent the spread of the virus. And so making sure you're reinforcing that culture of caring, that you care about people's well-being, is just very critical at this point. Last piece. Continue to be flexible is really important. We see this today. I mean, I was just had the news on. You saw how the schools will open and only to close within a week. Sometimes because of the fact that there is this incidence of spread. You want to, I know that in March, we were talking to owners during the March timeframe, we were really focusing on how to pivot your business. Many, if not all, had really developed virtual capabilities. They've really thought out of the box. Now that you're open, you want to continue to nurture those capabilities. Maybe you have expanded your capabilities, but you want to make sure you continue to think in those terms and also nurture those approaches, because there could potentially be a time where you have to rely on them again. So be flexible during this time and continue to sharpen your thought processes around your business opportunities. Our next speaker is going to be Teak, and he'll give us a community update.
Hey everybody, thanks for having me. Thanks Denise, thanks Marshall, thanks Kathleen, thanks Lori, and thanks for the group for getting this all together. I know we're a little bit behind plan. I want to make sure that my colleagues have enough time, because they're really the experts in their fields, and you're going to want to hear specifically about what they have to offer. I'm going to give you kind of the overview, and I know you guys really would love to know kind of where we are right now, and understand more about this pandemic, which is unfortunately very much alive and well throughout Lancaster County and the surrounding counties. So Jeremy, go ahead and advance it for me. So this is an overview, guys. You will have this PowerPoint to reference, and it is very self-explanatory. So I'm going to try to move us forward and kind of get to some key slides here. The one thing that I want to point out, for the most part, everybody understands the virus by now, so I don't need to really harp on what it is and what the issues are. Again, the emphasis you're going to hear is still the same thing I've been trumpeting for the last 4 months or so. It still comes down. This is spread by droplets. That 6 feet barrier, that distance is real. speaking, coughing, sneezing, it's absolutely real. So everybody's so focused on, Lori's going to talk about this a little bit about even like contact surfaces and otherwise, that is a factor, but the primary way you contract this is airborne droplets. And so you want to cover your bases, but gosh, man, like the masking is absolutely necessary. The droplet transmission is absolutely real. You can get in here the symptoms. These are really kind of common symptoms that you guys experience with other illnesses. So it masks itself. You need to treat these symptoms as real. And there's nothing wrong with having that relationship with a primary provider or urgent care. You want to be safe than sorry. Getting out there. The key on this infection is infectivity. The infection rate of this disease, which is the reason why it's so problematic. People keep looking at the mortality rate and otherwise. The issue is the infection rate. It is worse than the common cold. It is twice as worse as the flu. It's even worse than the Spanish flu. It's even worse than Ebola. The infection rate is very bad. The mortality rate is worse than the regular flu. It's obviously worse than the cold. But the issue is the infection rate. So it spreads like wildfire. It will find people who are vulnerable and susceptible. So that's the issue. It's not so much the healthy person. The healthy person is an active carrier. What we're trying to do is cut down the transmission so that we don't affect those who are most vulnerable. And it's easy, guys. It's so easy to prevent. So that's what I want to share on this slide. Go ahead, Jeremy. Next one. So again, this is the same stuff, guys. I mean, you guys know it. I don't need to tell you. It comes down to the masks. Masks absolutely work. And I kept some slides off just for the brevity of the presentation. There is so much data that shows how much it cuts down, how much the social distancing, how much the masks, how much the hand washing cuts down on the spread of infections. The science is clear. So if anybody disputes it, the science is out there, and it's just ignorant not to respect it, and it's ridiculously easy to do. And again, my colleagues are going to talk about how we can combat all these other opportunities. Next slide, Jeremy. So here it is, guys. Here's the nuts and bolts, which you want to hear. You guys have access to this, and just like Denise said, this is constantly evolving, and thankfully it is evolving. We're getting better at how we're treating patients. We've figured out that putting them on ventilators is a 50-50 mortality rate. We're trying to keep people off of ventilators. We're trying to make sure that we minimize hospitalizations. We're trying to make sure that the age-related therapeutics that we have, all of that stuff is really important. But the cases are still out there, and people talk about the testing, and that's not the issue. It's alive and well. So what you're looking at here, you have this on the Department of Health website, the Pennsylvania website. And I just kind of gave you a snapshot of what's going on. What you're looking at on the left-hand side is Pennsylvania. The top side is how the cases have trended. The bottom is how the deaths have trended. Yes, we've completely dropped off from the deaths, primarily because we figured out on a hospital side how to treat it. And we've done a really good job of nailing that down. But the infection rate is still active. And overall in Pennsylvania, see, we were all peaking out. Every county was peaking out in that April to May period. And then we came down because of the precautions that the state imposed. As restrictive as they were, they worked. And so you can talk politically all you want, they worked. And we have flattened the curve. And then you look over at Lancaster on a much different scale, but the trend is still concerning because we literally did what we were supposed to do. We flattened the curve. You can look at it, it is flat. But that's the best it is right now. It is flat. It's still out there, and it's not going to be hard for it to spike up. And we're all looking to, when we reopen the schools, not so much for mortality rate on the kids, but the fact that that's going to just rock through families if the schools and the families aren't being precautious. And that's the part that we're concerned about. You can see on both Pennsylvania and in Lancaster the spike that went up in that June to July period. All that's related to the reopening, which is fair, but it's the socialization of the reopening and the compliance with the guidelines, or the lack thereof of the compliance with the guidelines, which got us there. And we're anticipating another rise when the schools reopen. Plus, too, as we get into the fall, people are going to migrate back to indoor activities. Now you're just creating another hotspot opportunity for transmission, getting away from the outdoor stuff. So that's an issue. The issue on the right-hand side is the Pennsylvania distribution of cases and deaths. So you hear all the time about, well, it's an older population concern. It is. From a death rate, absolutely. You can see on the bottom side, the 60, 70, 80 plus year olds, that's the mortality rate. But look at the top slide, guys. It doesn't, this virus does not care how old you are. You are going to get it. Right? Look at 20 to 29-year-olds is the highest level of infection right now in age population. And the kids were at 0 a couple months ago. It continues to rise. So it's an issue. Every age can be affected by this. Don't let them fool you. They're a little bit more resilient, obviously, and the mortality rate is lower. But we've had 25 multi-system inflammatory syndromes in the kids in the state, just this state. So we don't know this virus yet. We don't know the impact. So we're all still learning, but this should hit home for everybody. That it affects everybody. It doesn't care how old you are. Mortality is different, but the spread is going to be tremendous if we don't respect it. Go ahead, Jeremy. And then this is it, guys. And you're going to hear from my colleagues. It's simple, guys. It's prevention, exposure management, and then the other issue is the quarantine status. And if you do the first two, the third one is never an issue. However, if you ignore the first two, the third one is going to kill everybody economically, if not physically. So that's the part that you have to kind of respect, and that's what my colleagues are going to be able to kind of guide you on. All right, Jeremy, next one. This is kind of looking at the testing overall. You're looking at on the schools, which we're getting ready to reopen. We don't do asymptomatic testing, not because we don't want to. The CDC says the stats aren't there. There's no necessary part of it. And if the more asymptomatic testing we do, the more it clogs up. The more it clogs up on those that need it. So we're trying to set up a separate pipeline, and I'm hoping to have something within the next week or so for the employers to take advantage of, but it's taken a little bit of work. If you have travel issues, you can come to us because if the states or the country restricts access because of that, you can get the test. Go ahead, next one, Jeremy. And then here's all of our testing locations. If you're symptomatic, you go to the family doctor, you go to urgent care. You don't have to have a script if you want to run to our urgent care testing areas. If you have the symptoms, they'll check you out right then and right there. So we're trying to be completely available for everybody. I mentioned about asymptomatics. The only real asymptomatics we do is for the pre-travel and for pre-surgery, just to make sure that we don't infect the surgical rooms. Next one, Jeremy. This is the positivity rate. I'm just wrapping up with the last two slides. This you can see on the yellow line is the positivity rate of the testing. So you can see to a degree, absolutely, that as the test volume goes up, you're going to have the positivity rate is going to come down a little bit. But look at how much we're trying to test. We're trying to test significantly, and we were able to get more and more tests beyond the May period. So early on, we were testing virtually everyone that's symptomatic and no non-symptomatic. And then as we continue to test overall, we're getting more and more and more people. But look at the positivity rate. So the positivity rate for us in the hospital literally today is 9%. 9%. So just under like 1 out of every 10 is having a positive. So ultimately, we want to get that down to about 5%. So again, it's alive and well. And despite the bulk, we've done 45,000 tests in this county since it began. We're doing pretty well when it comes to testing availability, but that positivity rate is really holding steady at about 9%. Go ahead to the next one. Turnaround times. That's the next question. As employers, that's your issue. Is how quickly can I get the results? Because I want somebody to know if they're showing symptoms, are they positive? If they're positive, they got to be out of work. And then those that have close contact, they also too have to be out of work. So this turnaround testing time is very important to you. And for the most part, it's 2 to 3. 2 to 3 days is where we're at. We expect it to come down under 2, if not a day, and starting next month. We're getting reagents more and more and more, but we're trying to be prudent on managing all those resources and not testing people unnecessarily. Next one. This is the last thing. So the last thing I have for everybody is I think the last one. Ultimately, we developed a program back in May that allows us to take our occupational medicine team and our employee health coaches to employers' locations, do a site walkthrough, and my colleagues have this available through them as well, where we can go and evaluate your readiness to combat this. Make sure you have social distancing and all the precautions necessary within your workplace. We also look at your policies. We educate your staff, you and your staff, because the issue is there's irrational anxiety that's going on, and the more we can educate people, the more we can rationalize their anxiety, control it. That's very important. I tell people all the time, before you address your customers, you have to address your staff. And once you do that, you'll get compliance and the customers will follow suit. So the more educated your teams are, the better off you're going to be as a group. I think there's one more, Jeremy. Maybe that's it. Nope, we're good. I tried to roll through it pretty quick. So hopefully that was informative for you. And I'm available for some quick questions. I need to drop off at the 9:30, so I apologize for that.
Teek, there was a question. It said about, Kathleen had asked if you could speak to the long-term effects of the virus on individuals of all ages who contracted it.
Yeah, you know what? The way I can speak to it is we don't know, which is super scary. We don't know. We don't even know yet if you get the virus, if you can't get it again. We don't know what it's going to do. This is completely new. So ultimately, I think that's the part you have to worry about is we just don't know. We thought kids were virtually immune, and now the multi-system inflammatory syndrome has popped up, which is devastating. So we just don't know enough.
Other questions for Teek?
There is. I did. There's my email, or HealthWorks, Penn Medicine HealthWorks email down at the bottom there, which you can email us if you'd like us to help out in any way.
We also have at the end of this presentation a list of contacts as well that you provided to us as well, Teek. All right. If there aren't any questions, we'll go to Monica. Thanks a lot, Teek.
Thanks, Teek. That's awesome.
Good morning, everybody. My name is Monica Ricklizzi. I am the owner of Enter Training Solutions and a SCORE mentee, so I'm thrilled to be here. Thank you for inviting me. I just want to talk about some of the OSHA regulations involving our businesses and how it kind of plays into the whole COVID situation. So next slide for me, please. I think there's a lot of confusion for small businesses as to who's actually regulated by OSHA. So I wanted to go through who is and who is not exempt from it. First off, OSHA only covers private sector businesses. So if you are a government employee in the state of Pennsylvania or receive state funding for your salaries, you would not be covered under OSHA. Next one would be if you're self-employed. If you are self-employed, working on your own with no employees, you are not regulated by OSHA. However, the next point would be if you have any employees, you at that point must comply with the entire OSHA standard. Next one would be if you run a farm. I know we're a big agricultural community. If you run just a family farm, you are not regulated under OSHA. But the next point would be that if you have anyone that works there that isn't a direct family member, you at that point are regulated by OSHA. The last one is if you're regulated by another agency. If you're underneath MSHA, which is Mine Safety Health, that's our quarries and things like that, Coast Guard, anybody else like that, you're not under OSHA regulations. But for the most part, our retails, our restaurants, our salons, all of you guys are regulated under the OSHA Act. So moving on, if we find out that we are regulated by OSHA, what does that mean for our businesses? So this is a very quick review on what our requirements are for our businesses. But the first one, we kind of lump it underneath the general duty clause. And what it says is you're required to provide a workplace that's free from serious recognized hazards and comply with the standards, rules, and regulations issued under the OSHA Act. So recognized hazards, that includes things like COVID, because at this point we know it is a hazard. We understand that it can impact our businesses. The next one is examine your workplace conditions to make sure they conform to the applicable OSHA standards. There are standards for everything from fall requirements all the way down to bloodborne pathogens and health safety. So we need to make sure that we're following those regulations. The next one that we have is employers with hazardous chemicals in the workplace must develop and implement a written hazard communication program and train employees on the hazards they are exposed to and proper precautions. This includes keeping a copy of our safety data sheets. That one is really going to come into play, especially now that we have COVID, because when you deal with HazCom, a lot of you think, I don't have chemicals. Those cleaning supplies that we're bringing into our facilities, those are hazardous chemicals. And we really need to understand and train our employees how to use them, how to store them, what not to mix them with, etc. I'll talk about that in a little bit. The next point I have is you are required as an employer to post at a prominent location within the workplace the OSHA poster. It's a free poster you can find on OSHA's website, osha.gov. It must be posted somewhere where your employees have access to it, maybe a a break room, or perhaps a time clock area, something like that. The next one, provide most PPE at no cost to our employees. PPE has been a big thing that we've been talking about right now with COVID hanging around. So there's certain things that we are required to give to our employees at no cost if it is something that they have to wear for work and they wouldn't wear outside of work. So that's going to come into play with things like gloves or other things like that. Next one that I've got is, this is a fun one. Follow our reporting and record keeping requirements. If somebody gets injured or killed at work, we need to make sure that we notify the local OSHA office. We also need to keep records. That is for most businesses that have 10 employees or more. Those records do need to be submitted to OSHA every year. Okay, so next slide, please. What does all of this mean with COVID going on? Number one, OSHA loves having plans. So we like to have written plans for things. And so what we want to do is we want to have a pandemic plan and we want to stick to it. And what I mean by stick to it is if we're going to write it down and tell our employees that we're going to enforce it, we're going to enforce it with everybody universally. We're not going to allow exemptions for certain times. We're not going to allow exemptions for certain people just because they don't feel like doing it or it's extra hot that day. We want to make sure that we stick to what we say we're going to do. Now, with that being said, my next point is that plan has got to be flexible. As Teek said, we are constantly learning about this. We are learning new things that help us combat it. So if we have new data out there that the CDC pushes out, we need to make sure that we're willing to adjust to those changes. The next one that I have is if you go onto OSHA's website, osha.gov, there's a lot of guidance on how to abide by the OSHA rules. So they talk about assessing the hazards to which our workers may be exposed. So we need to make sure we take a look around at our workplace, see where they're actually interacting with people, and see how we can evaluate that. So if you could give me my next 2 points on here. The next one as well. Yep, evaluate the risk of exposure. So if you go on OSHA's website, again, they'll give you kind of a list of a low, medium, and high risk industries. And then we can kind of figure out how we're going to combat this. So once we figure out what risk we are and where our risk is, we can then figure out the controls we're going to use. You've seen them in our grocery stores and other places. They include things like an administrative control, which is social distancing, just keeping people apart from each other. They include engineering controls like physical barriers. And they also include PPE like masks and our gloves. Now, with that being said, my next point has to do with be careful with our PPE. First off, these masks. N95 got pushed out by the CDC as one of the first things that they said really helps out with everything. And absolutely, it is the great choice for healthcare industry. However, I highly caution you against providing N95 masks for anybody that is not healthcare industry due to the fact that there's a lot of extra regulations that go along with those. Those are actually considered a respirator by OSHA. And when you ask your employees to wear a respirator, you are legally required to have them go through medical questionnaires. They have to go through training and they have to go through fit testing, which means we need to make sure those N95 masks fit. They are not a universal fit. Please be careful on that. My next one is the teaching employees proper donning and doffing techniques. Donning and doffing are just safety nerd terms for how to put things on and how to take them off properly, especially when you talk about things like gloves. If somebody's wearing gloves and then doesn't remove them properly, they're exposing themselves anyway to everything that they were trying to prevent. There are certain ways that you can do this. You can go on to OSHA's website and look at their recommendations. You can have somebody come in and teach you how to do all of that kind of stuff. But it is super important that you understand that just providing the PPE is not enough. They need to understand how to properly use it, take care of it, and put it on and off. The last one has to do with that HAZCOM program that I discussed earlier. We need to make sure that we have the safety data sheets for the hazardous chemicals that we are bringing into our facilities, as well as labels on our containers. You can't just put this into a spray bottle with no label on it and put it on your counter. That is an easy OSHA violation and a costly one. I can't stress how important this is with cleaning supplies. If you go into the news and look what happened in November up in Massachusetts at a Buffalo Wild Wings, they had a fatality up there. There was a gentleman who was cleaning the kitchen, mixed 2 different cleaning chemicals into a bucket, and made a vapor that was fatal. It ended up costing the manager of the facility. They had a lot of customers in the facility. The manager spent the most time trying to get the customers and employees out, and he was only in his 30s. He ended up passing away from that chemical mixture, and that was at a restaurant. We have to understand that when all of this is happening, we're bringing in new hazards, and we need to train our employees on how to manage them. All right, I think that is the very quick and dirty for how everything works with OSHA. I'm going to pass this on to Carl Schock for our HVAC issues.
Hi, I'd like to, start talking about indoor air quality and how it's really come to the forefront with the industry of HVAC and to keep everybody safe in the workplace or even in home. Next slide, please. The biggest thing is making sure that you have the proper airflow and fresh air to a building. The current COVID-19 can live in the air for about 3 hours. So if you're not introducing any new fresh air into your workspace or even into your home, it's gonna hang there for a long time. And by increasing the fresh air to your home or your workspace, you're gonna push that out and you're gonna lessen the time that it's actually hanging in the air. So there's a lot of key things that you want to make sure that you're getting proper ventilation into like your office, making sure that there's no blockages on vents. And this is probably a big one because a lot of office buildings, what you see, people are going to tend to put boxes over the vents. You'll get people complaining that they feel cool drafts, so they'll cover the vents. When they're doing that, they're really hindering how much the air is moving around the building and leaving the building and introducing fresh air. You want to make sure that you change the air filters regularly. Office buildings, every 4 months would be probably the longest you'd want to go without changing them. Just to make sure that you're moving that proper amount of air. Performing a system PM, the important part about performing that is making sure that the coils and so forth are clean. Besides what we have going on right now with COVID, bacterias are also still a major concern in buildings. And if you're not cleaning coils and you're not cleaning drain pans, it's amazing how quick a system can build up, like with mold. And then that gets to spread through very quickly just from the lack of maintenance. Your fans, making sure that your fan has efficiency. And this goes back to like your vents. And a lot of times I use, restaurants are sometimes the best example to use for like dirty vents. If you go in and you look up at the ceiling and you just see a lot of dirt coming out of where the supply vent is, it just is a sign that the system is lacking of maintenance. Check your thermostat, make sure that it's functioning properly. And letting your fan run all the time is the biggest thing that you can do. Like every thermostat or control system will have like the fan on, fan auto. What that does is it's just circulating air constantly when you set the fan to on. So 24/7, you're moving air A lot of office buildings, people like to, close their doors. And if you're not, when the door is closed, you might not be pushing the air out of your office as nice as you would with the door open. Good indicators of that is if you're looking like under the door, if it's carpeted office, you'll see dirt stains and stuff under the door. That's not necessarily just from people walking in and out. It's from the air trying to push under that crack of the door. So like that'd be something to look for to make sure that you have the proper airflow. Um, Another big thing is like when you're having meetings and if you have a couple people in a room or in an office, you'll start to feel like that drowsy. It's not always because the meeting's boring. A lot of times like CO2 is just building up in the room and you're not introducing enough fresh air. So making sure that you let that fan run all the time. You're circulating air 24/7. In a home, if it's a 2-story home, a lot of people complain like the upstairs of their house is warmer than the down. Usually letting the fan run all the time is good for 2 degrees. So if the downstairs is 70, the upstairs is 74, it'll kind of equal out the upstairs down to like 72. And also with asthma, allergies, and pollen, you're constantly filtering out the air because it's going back through the main air filter, which is a good thing. And then it's coming back out with a lot less particles in it. So next slide, please. With the filter changes, with letting that fan run all the time, there's a lot of different style filters that you can use. MERV ratings are how filters are graded. You can go as low as a MERV 4, which is a blue throwaway filter that you can pretty much hold up and you can see through pretty easily. And they'll go as high as a MERV 13. The MERV 13 filter is a very dense filter, and they're catching probably about 90% of the particles that move through it. You have to be a little careful, like upping that MERV rating to the 13, because it will put more strain on your system. It does decrease airflow a little bit. So you definitely, like if you're going from like a mid MERV 8, MERV 10 was like the most popular. So before COVID-19, the MERV 8s, MERV 10s were what everybody was pretty much buying. Lowe's and Home Depot would sell like a really heavy 3M filter, which were pretty hard on your system and you might have more problems with putting them in. But now with COVID-19, a lot of people are going to the MERV 13 just to help reduce any droplets and so forth that are in the air and trying to do preventive as they can. Problem we're running into right now with that is like the MERV 13s are like a month to a 2-month back order on your common sizes because everybody's just scrambling to go that way. The higher the MERV rating you go, you would want to definitely make sure you're changing your filter more frequently. It's going to get dirtier quicker. So if you were on like a 4-month plan at a MERV 8 and you go to the 13, you might want to be like 2 months to even just checking it every month. But the biggest thing is just making sure it's being changed frequently. MERV 10 to MERV 13 is what I would recommend. And having a contractor or somebody make sure that you're not hurting the system by going to that 13. Next slide, please. UV lights there's such a broad range of how many UV lights are out there. They're really putting a lot of research and time right now because everybody wants to be on the forefront of this. And it kind of goes back to what I said at the beginning, like air quality wasn't even really thought about in buildings until this happened. A lot of times in buildings after the inspector was in, if you had high humidity because you were introducing too much fresh air, the first thing that you would do as a contractor, and I never did this, but you would shut the fresh air off just to keep the humidity down. And a lot of people who work in office buildings know what I mean when they say like the papers are curling, like that was always like your first indicator. The UV light is being really pushed right now. Everybody's wanting, to advertise theirs as the cure-all. There's so many different styles. You have some that put out peroxide along with the UV, which I've tried the peroxide one, and you have to be real careful with that because when you set it too high, like just the smell, it gets intensified. I've tried, like they have UV lights out there that put a little bit of ozone off into a system. You have to be extremely careful with those too. If people are asthmatic, the ozone will trigger asthma attacks. I personally put one of those in my house probably 3-4 years ago when they came out. Everybody was talking about how great they are. My wife's asthmatic, and she said to me, she said, "Did you do something to our house?" I said, "No, what do you mean?" So unplugged it. Week goes by, she stops complaining that her asthmatic, and then plugged it back in just to kind of see, and it happened again. So at the time when they came out, everybody was really hot on those and trying to push them. But there is a lot of downfalls, and you need to make sure you're doing your research, like when you're putting in the UV light. The standard UV light, um, I like the dual bulb. You size it for your airflow. So like your contractor, and this is just it's such a broad range. Like we can range from $90 on a UV light to $700 for a UV light, and it'll do the same system. I actually, at the current moment in my house, I have just like a Honeywell dual bulb UV light. And knock on wood, I have 3 kids. I do swear by the UV. Like my kids don't get sick very often. 2 of them had perfect attendance last year. And I do think a lot of it is just that air quality and the things that it can help take out of the air and remove, as far as, molds, bacteria, slight viruses. It is advertised that they will remove. But it's still, everybody, like I said, is pushing to see who can be the first one to say, this is the fix. Hospitals and clean rooms have been using UV lights for a long time. It was when the COVID came out, it was kind of interesting. A place that I've taken care of for 16 years called me and said, "Hey, we got to change those UV bulbs." I was like, and this was a medical building. I was like, you only have them in like your hallways. Your equipment don't have them. Like I said, it kind of, to me, went back to like air quality was always pushed to the back, but now it's really come to the forefront. And fresh air is the most important thing you can do, in my opinion, and making sure your filters are changed. Next slide, please. Just a summary on what I probably rambled about here was just having fresh air into your building. The big thing that you have to watch with when you're introducing the fresh air is humidity. We live in Pennsylvania. It's a very humid state. So if the equipment, wasn't designed to bring in a lot of fresh air, you're going to notice like the paper's curling. You're going to notice a lot of different things. And the filter changes. You can get a HEPA filter for your system. So that is an ultra fine filter, and it's fan powered. I'd like to turn it over to Lori now.
Hello, everybody. How's everybody doing on this wonderful Wednesday? It is Wednesday, right? I'm losing track of the days. It's been kind of crazy. My name is Lori Holmes. I am the Health, Wellness, and Safety Specialist at Americhem. You can go ahead and go to the next slide, please. And so one of the things that I speak to quite frequently, I feel like I'm on this whirlwind tour of training as of late, is to how to stop the spread of infection through proper cleaning and disinfection. So as you see to the left is a COVID poster from the CDC. They do have a lot of great resources, and all of those 6 steps that we do to reduce the spread of germs, it's nothing new. All those things I would have talked to 2 years ago, 5 years ago. One of the things, though, that I'm going to pay attention to today is the frequency in which we clean those high touch areas. On the right, you see the chain of infection, and essentially whenever we're cleaning, that's exactly what we're doing, is we're breaking the chain of infection. So the first one is a pathogen, second is the reservoir. That's where the infectious agent would live, most commonly our hands. Portal vexit would refer to how does it come out of the body, is it a sneeze, a cough? As Teek spoke to earlier, it is airborne droplet. So if we cough or sneeze, and this is why we need to maintain that 6 feet distance, and we're wearing a mask to prohibit the length or distance in which that sneeze or cough would go, which, by the way, please don't remove your mask to cough, or do not remove your mask to sneeze. I witnessed both of those things happen in in a Home Depot and at an Ollie's. So yeah, don't do that. Next is the means of transmission, and that's how does it travel? Is it direct contact from a surface, shaking hands? Again, do I cough? Is it airborne? Um, Other portal of entry could be also the eyes. So again, we want to protect our airways, and also safety glasses are a good recommendation. Next is portal of entry. How it comes out of the body, it typically can re-enter the body. In this particular case, it's entering our airway, or again, the other portal of entry would be the eyes. And lastly, we have the new host or susceptible host, and that's dependent on age, nutrition. I worked at a level 1 trauma center for 10 years. So as soon as a trauma is rolling in, they're considered susceptible. And so we all must play our part in breaking the chain of infection. Go ahead to the next slide. So this is a really great and quantitative way to measure clean. I can look at a surface and it can look completely pristine. However, we use this luminometer device to take a swab. We put it in the luminometer and it will give us a good read. So this particular day, I decided to do a science experiment in my kitchen. And as you can see, it read at 6,713. I then did proper dwell time. Dwell or contact time means you're taking that chemical, whether it be a sanitizer or a disinfectant, and you're reading the label per the manufacturer's recommendation. And if it says 2-minute dwell time, you leave it on for 2 minutes. If it says 10, you use 10. So you can see the difference in time here between 116 and 128. Did the proper dwell time. I used physical cleaning to remove the soil. I reran the test and I was able to bring it to 0. I was even impressed with myself that day. I was like, wow. So here's the big reveal. Guess what I cleaned? And we can all relate to this. Go ahead, click on it. The dog bowl. Disgusting, right? So if you've ever picked up a dog bowl and it's slimy, that's really just a biofilm that has been growing with bacteria, moisture, and time, okay? So pre-COVID, we had plenty of things to worry about. For example, MRSA can live on a surface 3 to 5 months. So I've always been preaching to cleaning and proper disinfection. Now, again, we're just kind of on steroids with this presentation that we're doing, because we should not be complacent in our approach to cleaning whatsoever. Go ahead. So let's talk about how do we break the chain and maintain consistency. First, it's a mindset shift. Imagine you're the customer, perception is reality. I spoke a couple weeks ago, and I swear to God, the whole time this guy had hired someone just sticking out the door. This lady was wiping down everything. So again, perception is reality. We turn the TV on, we see a lady at the hospital wiping down the banister, right? So next one. Next, we want to, as Denise spoke to earlier, create a cleaning, sanitizing, disinfection program, adhere to the manufacturer's instructions, focus on high-touch areas. Physical cleaning needs to occur. And again, walk into that space and act as if you're the customer and picture yourself all those places that you're going to frequently touch. Next one. Use EPA pathogen list approved disinfectants. So in March 2020, the EPA published a list of chemicals and products that would fall under, it's kind of a benchmark, if you can picture this, that anything that would kill, for example, human coronavirus, we then could use to combat COVID-19. Because, and again, this is such a new virus, we don't have enough intel. Lysol was recently stamped, deemed with that notorious EPA registration and approval. However, I don't know if you've ever looked at the back of a Lysol can, but read the directions. You have to lay enough product for approximately anywhere from 10 to 12 minutes. That's a lot of Lysol. So I always recommend using either a ready-to-use disinfectant or a dilutable product. Go ahead, next one. Arm yourself with the right tools, product, and again, I think Monica has spoken to this, and Denise can agree, the follow-up part is the key ingredient to this process. You can lay out a program, but if you don't follow up behind it, it's going to fail. Next. Apply universal precautions theory. And what does that mean? It means that you're going to pretend that every patron or customer walking to your store can have the worst possible disease. I always joke and say when I'm presenting, if I start bleeding profusely, I would expect the person coming up to help me to put gloves on, first and foremost. And of course, they would have a mask and protective eyewear at minimum. Next. And we already talked about MRSA me. Proper mask wearing. And again, not under the nose. Do not remove to cough or sneeze. Don't remove your mask to have a conversation on your cell phone while you're in a store. I've seen that a lot. Go ahead, next one. Consider placement of the items relating to best practices. For example, if your trash can is in your bathrooms, if your trash can is away from the door, you want to put that trash can right by the door. And why do I say that? You want to enable your patron to grab a paper towel, turn off the faucet if it's not automatic, then grab the door handle. It makes no sense to wash your hands for those 20 seconds or 30 seconds and then recontaminate yourself. Can you get him? Thank you. Sorry, my daughter's cat is in here bugging me. So please consider your hand sanitizer stations. What I see a lot of is people are putting hand sanitizer in the actual bathroom. I would discourage that because that may give a false impersonation to a person that's like, oh, okay, I can just use the sanitizer and roll out. Most effective practice is to wash your hands for 20 seconds. Go ahead. Be flexible in this state of MacGyverism, as I like to call it, because we have such shortages in products. We're having to shift gears. For example, Clorox wipes, big one. They're being allocated to healthcare systems down. We get them. We have to allocate to our end users as well. So you have to adapt to using other methods, such as a charging bucket system. Go ahead. You can click. Thank you. There we go. I'm dating myself with that MacGyver reference. Go ahead and click again. So here's an example of a chem wipe. It's a dry wipe. You would take your dilutable product, or actually more preference is to use, or better preference rather to use, is a ready to use product. Unscrew the top, throw the quart bottle in it, let it charge up, and then boom, you've got your disinfectant wipe. And we have sold tons of these. We sell them by the truckload before they even land to us. They're already sold. It's crazy. Go ahead. So thank you guys for your time and attention today. Please reach out to me if you have any questions. Again, I do lots of training, and perception is reality. People are actually putting certificates up after I've trained. Right as you walk in the door, the certificate's sitting there and says cleaning and disinfection right on it. So please reach out if you have any questions. Thank you guys for your time today.
Jeremy, if you could show the next slide. There's some example.
Oh yeah, there's an example. I forgot about that slide there. The one on the bottom right is at the Tread House gym in downtown Lancaster. So they have that prominently displayed. And I am CMI certified as well. See, that's me, a little cheerleader at the top there. Just kidding, that's Will Ferrell. Somebody else.
So if you'd like some questions, the team is ready to answer them. I know, Carl, there was a question for you during your presentation about how often to do preventative maintenance for ventilation systems.
In a commercial building, spring and fall is always a good time to have it done. I would definitely recommend twice a year. In your home, if you're getting it probably done once a year, you're being sufficient. With back to the commercial part, if you want to make sure, like if it's there's certain commercial buildings that should be done 4 times a year. It's just a variance, and you almost have to trust like your contractor when they come out to say, hey, this one here's a little bit more of a situation where you need to have it done 4 times a year. Heavy used office buildings would be 4 times a year. Factories 4 times a year. And like something that you'd want to make sure you're looking for too, like when they come out in that springtime, is making sure that they have like a garden hose and they're washing your coils and they're washing down the drain pans. Like if you don't see the contractor doing that, then you might need to kind of reevaluate what they're doing. It's like the adage of taking your car to the garage and they say they fixed something. You're kind of like, where are the old parts? We got rid of those. It's just a good way for the customer to check and make sure that they're getting what they're paying for. But 2 times a year for a building, and I would say once a year for your house.
Another question was about scrubbers and air purifiers. Are they useful as well?
They're more geared right now towards the home. Like, it was just stuff that was never really taught or talked about for commercial buildings. Now, if you have a commercial building with like a residential unit, the scrubbers do work very well. The General Air 500 HEPA filters are great. The biggest problem is if it's an office building that has like a larger unit, and it wouldn't be necessarily like a residential style. They don't really have anything out there yet that's going to take care of that. Air quality, because you can only move so much air through those, and that's kind of the problem. And that's where everybody's just really scrambling now to increase the market and spread it to commercial. It was just never thought about, really.
Carl, can I speak real quick? We actually
Sure.
work with a company called X Power. I believe one of my colleagues is on right now, John Steuben. He can speak to that really quick. John,
Yeah,
are
I'm
you
on.
there?
I'm
Awesome,
here.
Cool.
On the definitely on the smaller aspects, on smaller commercial spaces, we have multiple units out there. But like he had stated also too, on the big commercial spaces, that's something that's out of our wheelhouse. That's something that would be a HVAC specialist on that, because that's the one to be installed internally into your actual system.
And
So
it's just
they're best used for small spaces. Is that what you're saying, Carl?
like smaller systems, like some office buildings might have like a school bus size HVAC unit. So like in those systems there, you might see bag filters, which are a very good filter, but a lot of times it's just your standard 2-inch filter. So if you were looking to upgrade, it just affects the system so much, because like when you go to like a bag filter, it knocks down the airflow. Um, a lot of like some office buildings might have like 8 units, and they are smaller, and then that's where like the scrubber and stuff would still be in play. But you can get like, it's just a variance on what the building has. It was kind of like a preference thing, I guess. Like we do a large 5-story building that has 2 systems, so they're huge. So to do anything like to upgrade them would be very difficult, just because of the way it was laid out and designed. We do another 5-story place that has bag filters in the works. It's top-notch air quality stuff. It's hard to go back and do it again, like after it's in and designed. But like on smaller systems, you have a much more flexibility. And that's the same with the UVs. Like the UVs are sized for airflow. So like when you're talking, that you're moving 20,000 CFMs, you need, a lot more UV light than you do at 2,000 CFMs.
Right.
So
We are seeing in our market a lot of increase on just a lot of the portable ones that are out there. They could be very small desktop units to even 600 CFM mid-size room, large air movers, air scrubbers, excuse me. People are just trying to do whatever they can do at this point, and just whatever they can run through those systems to try to help keep that environment safe is really the best. But we're seeing a big move on those.
Okay. Are there any
it's
other
definitely
questions?
definitely a big scramble right now to
Yeah.
see to keep people safe.
Sure. Are there any other questions of the attendees?
For ease of reference for our attendees, would each of the speakers mind providing their email addresses in the chat box for any follow-up questions?
Sure. We actually have that at the end of this presentation. Jeremy, if you could show that, I think we have, toward the end, we have all the information for SCORE, if you want a SCORE mentor and need support. But for Penn Medicine is the next slide. All the contact information there will be for them. And then also contact information for Monica is the next slide. And the EGI HVAC team, the next slide. And then last but not least, American. And then our last slide is actually a reference list for participants so that they would be able to get to the some of the reference materials that we've actually referenced during this presentation. Of course, the Recovery Lancaster website continues to be a great source and resource for us as well.
We'll be happy to add these various links and contacts in our minutes as well, Denise and
Thank
John.
you so much, Kathleen.
Thank you.
Our
Kathleen.
pleasure.
Thank you.
And then, of course, Lori will go in and correct all the typos.
We will make this the PowerPoint available to the merchants as well.
This PowerPoint is already uploaded to our website.
Great. Great.
Thank you. That's awesome.
So, are there any other questions for our great panel? For everyone, well, thank you all so much. I mean, this was very, very helpful information for all of us and the merchants especially. So just as a reminder, this recording will be made available. The PowerPoint is already available apparently on our website. So thank you, Kathleen. Kathleen, did you want to take a minute and do a quick member intra-marketing committee report?
I think that the most important thing that I would have to say is that we are ready to launch Lancaster City Restaurant Week. So please look for that on social media, and we will be doing an email blast about it. It will be September 10th through September 20th. We'll be capturing 2 weekends in that, and we'll be offering lots of ways for you to support our local restaurants who are in really critical need of your support at this time. You can order takeout. You can dine outdoors. In some cases, you can dine indoors if you feel comfortable. You can purchase a gift card. You can purchase swag, t-shirts, ball caps, etc. We are betting that Lancaster will defy the odds of 1 in every 4 restaurants closing because of this pandemic, because of the nature of Lancastrians supporting our local small businesses. So please get behind Lancaster Restaurant Week and support our friends and neighbors who own our restaurants and cafes. And that would be it. Thank you, Marshall.
Great, thanks, Kathleen. And then as the final reminder, Velocity, LancasterVelocity.com. Get your tickets and please participate in the lookbook. So with that, everyone, our next virtual merchant meeting will be Wednesday, September 16th. So look for an agenda coming out prior to that. And thank you again to our panel, and thank you everyone for joining us today. Everyone have a good day.
Thank you.
Thanks, everybody.
Thank you.